Breast augmentation is one of my most common procedures. It's done for women really of all ages, not just the 20 and 30-year-olds that most people seem to think, but women up into their late 70s, early 80s. There's a couple different types of women that come to me for breast augmentation. Gals that are younger, that haven't had children yet, in their early 20s, late 20s, or even early 30s, that just don't like the shape and size of their breast. They've been usually thinking about it for a long time, and they're really happy to just get a little more volume and be able to change the kind of clothes that they wear. The next group of women are women that have had babies and maybe breastfed the babies too, and lost volume, had deflation and some skin sagging, and want to restore the volume that they had previously, or maybe even get a little bit more volume than they had before. The next group of gals are grandmas in their 60s, and they have their granddaughters that tell them, you know what, Grandma, you should get a breast augmentation too. And it's funny, I see it all the time. You wouldn't think it's true, but so many ladies come in and they say, is this silly? Am I too old for this? My granddaughter told me to come in and said that I can do it too. And I've hated my boobs my whole life, and you know, it's cute. Sometimes those are my happiest patients, because they've spent a lifetime wearing certain outfits, certain bras, trying to cover up things they don't like about their breasts with different bathing suits every single summer for 60 years. And they're just absolutely thrilled. There's a couple different types of implants. There's actually several different types that are used on the market: saline and silicone, smooth, round, and some textured and anatomical shaped implants, but by and large, smooth, round implants are used. I usually use the smooth, round silicone implants, which is this one here. This one's a saline implant, and it's probably a little hard to tell the difference on the video, but they feel really different. The saline implants feel kind of like a Ziploc bag of water, and in a real lean gal with thin tissue covering, you can kind of feel it underneath the skin surface. The silicone implants are squishier and softer and feel more like natural tissue. They both last about the same length of time. 15 years would be a standard lifespan for implants. And they both look very similar, honestly, but the feel is the real difference. Breast augmentation surgery takes about an hour. It's a pretty quick, easy surgery to do. Recovery is relatively simple compared to a lot of the procedures that I do. And gals are usually back to work in 2 to maybe 5 days at the latest. If you do more athletic types of activity or athletic type of job, like waitressing, nursing, being a plastic surgeon yourself and having to do liposuction, you have to take it easy for 6 weeks. No heavy athletics, no upper body lifting for 6 weeks until all the tissue is well healed and strong. And then you can be right back to your normal routine. Pain's very little though. It usually just hurts for a couple of days, maybe a week at the latest, and feels, for the gals that have had babies, it feels a lot like when your milk comes in and your breasts are engorged. Otherwise, it's very similar to not working out for a long time and then starting that hardcore upper body workout and just really feeling a lot of upper body tension. It's a popular procedure because breasts define a woman's body shape and femininity, both internally and externally. I don't think it's just television and media that make us feel that way, but that's a whole other philosophical conversation. But feeling like you look pretty without clothes is really important to most people, I would say. Feeling secure in your own skin and feeling like you look on the outside like you feel on the inside is a big deal. But feeling feminine and pretty and sexy, not just to impress some partner, but to make yourself feel self-confident. I think that's the primary reason people